Hello, good morning. Good morning, class. I hope can you hear me?
Yes, ma'am.
Yes, ma'am.
All right. Good morning. How are you doing? Please, I would like if everybody can put on their video because this class is going to be an interactive class, and I like seeing my students when I take them. So I would appreciate if everybody can put on their video so that I can see everyone. So I hope you can see me and you can hear me as well. So we'll be starting soon. I just want to give the chance for others that are yet to join to do so before the class actually starts. So let's wait for like a few minutes, maybe like 2 or 3 minutes for others to join so that we can start. But while we wait for those ones to join, I would like to introduce myself first. My name is Mrs. Oyewumi, and I will be taking you medical terminology for this semester. So as I quite know, most of the students here are for medicine and nursing, if I'm correct. Can you hear me? Please, if you can hear what I'm saying, I would like a response back, please.
She accepted.
Hello?
Good morning, ma'am.
Morning. So like I said, most of the students that are taking this course are for medicine and nursing. Am I right?
Yes.
Okay. So okay. So
Are you hearing me? What can't you see?
all right, so we can start now. So please put down rules. If you are not presenting or you are not called upon to talk, please kindly mute your mic because we do not want any interference in this class. I hope that is noted. So I think we can start now. So for those who were not here when I introduced myself, let me introduce myself again. I am Mrs. Oyewumi, and I will be taking you medical terminology for this semester. So medical terminology is very important, most especially for medical students, nursing, medicine students, to understand the terms. Because as a doctor, as a nurse, they can't be mentioning certain terms in your ears, and you'll be looking like, what are they saying? So you have to start familiarizing yourself with some of these terminologies so that you'll be able to address your fellow colleagues very well, as well as your clients or your patients that you'll be attending to. Some of these terminologies might be difficult to pronounce, but you just have to learn them because you have to learn them and know them to be able to know how to attend to medical cases, to know how to treat your patient very well. At times when we go to, at one point in time, we've been to the hospital, and when doctors say certain things, they might sound like jargons to us, but the truth is those things are not jargons. So in this today, what we are going to learn, we are going to learn medical word elements. And we have 4 medical word elements. We are going to learn word roots, are going to learn, sorry, we're going to learn word roots. I hope you can see the board. So we are going to learn word roots. We will also be learning combining forms. Combining forms. Then we'll also be learning suffixes and prefixes. Those of us that have done English, I don't think suffixes and prefixes should be strange to us. So we'll be learning suffixes and prefixes. So those are the 4 medical word elements that we are going to learn. And at the end of this class, we should be able to identify these 4 word elements and to be able to use them in medical words. And also, we're able to divide medical words into their components and also be able to define and build medical words and locate pronunciation and interpretation of pronunciation marks. So these are the things we are going to learn in class today. So let's just dive right into it. But before we start, we want to be able to know the origin of how these words come about. Let's do like a bit of history of how these words came about. We know that from time, medicine has been in existence for years. And most of the words that is being used in the medical field today had its origin from when the Hippocrates practiced medicine then as far back as the 4th century BCE. So most of the words that are being used in the medical field had its origin back then. But because of technological and scientific advancements, there has been modification to these words. Because today, back then, the Hippocrates, they do not use modern machines that we use today in the field of medicine. I will give you an example of the modern machine that we use today. Let's take the MRI machine, for example. That is the magnetic resonance imaging. Does anyone know what an MRI machine does or an ultrasound machine? Anybody that knows what it does, just have an idea of what the MRI machine does. Anybody? I'll start calling names. Cynthia, can you please tell us what an MRI machine is? Cynthia, please, you have to unmute yourself. I've said it that this class is going to be interactive. Hello? I think Cynthia is not. Emmanuel, can you please tell us what an MRI machine does? Or an ultrasound, anyone? An MRI machine, what it does?
It is a scanner that shows the internal structure of the body.
Yeah, it can be used to scan the internal structure to see. But during the time of the 4th century BC, they do not use that. But scientific and technological advancement has made it possible to be able to use the MRI machine, making it difficult to diagnose difficult diseases that they could not back then. So we are going to know some of these, learn some of these new terms that we use now. Though we are going to, most of those words, like I said earlier, had their origin from back then. So, and we know that a medical word consists some of the elements, we have word roots, we have combining forms, like I listed earlier, we have the suffixes and the prefixes. How you combine these elements and whether all of them are present in a medical word will determine the meaning of the word. We will still see how combining those words, why it is important for us to combine those words and the meaning it gives before and after the combination. So now let's start from the root word. A root word is a core medical term and it contains the fundamental meaning of the word. And it is the foundation on which other elements are added and developed to a complete term. Most root words are derived from Greek and Latin. Most root words are derived from Greek and Latin. I will give you two examples now. We have, let's take the word dam and take the word protein. These two words, they mean the same thing. They have the same meaning, but one is Greek and one is Latin. But they refer to the same organ. While dam refers to the disease condition, Kute refers to the anatomical structure of the organ. Now, when you hear the word dam, the first thing that comes to your mind is skin. Because when you hear dermatology, is when we add other words or letters to it that it gives meaning. But when you see the word dam, you know it refers to the skin. When you also see the word Kute, you know it refers to the skin. But in this context that is being used, we cannot really understand in full, but we know what it is being referred to. But when we add other words to it, that we will learn under combining forms. So, but the origin, we've learned the origin of these two words. One is Greek and one is Latin. So, most of the words in the medical field has their origin from these two languages, both Greek and Latin. So you'll be learning a lot of these terms, but because of modernization and the change in language, these two words, other letters have to be added to them to be able to give meaning to a particular body structure or anatomical structure, or to refer to a particular disease, which we will still learn later on as we proceed in this class. Now, we'll take some example of some root words. We've seen dam, we've seen protein. Now let's see other examples of some root words. So now we talked about dam. This one is, dam is a Greek word, but let us now say dermatose. Dermatose. Like I said, dam is a Greek word, so that means it has its origin from Greek. And this means the skin. But if you now say dermatitis, what does this word mean? Anyone? What does the word dermatitis mean? Who is Baker's iOS? Can you please tell us the meaning of dermatitis? Please unmute yourself. Let's hear you.
Good morning, ma.
Morning. Morning. So can you please tell us what is what dermatitis is? Sorry, your line is breaking. Can't hear you very well.
Dermatitis is a skin infection.
Sorry, I can't hear you very
It's more like no.
Hello.
Ma, I said dermatitis.
Okay, inflammation of the skin, exactly. So this is a
Ma,
okay.
can you hear me?
Your line was actually breaking, so but I could hear a little. So dermatitis means the inflammation of the skin, and you know I said this down refers to a disease condition. So this is a disease condition. Now let me now say subcutaneous. Subcutaneous. What does this refer to? Subcutaneous, what does it refer to? Jason, can you please tell us? Please unmute yourself. What does the word subcutaneous mean? Jason. Who else is willing to take that? Hello?
Ma, can I try?
Yeah, please do.
If cutaneous means the skin, refers to the skin, so subcutaneous means under the skin.
Yeah, thank you very much for that. Your name, please.
Emanuela, but my name on Zoom here is Becky.
Okay, Emanuela, oh, thank you for that. So it means beneath the skin. You know, I said cutaneous refers to the anatomical structure, not while derma refers to the disease. Now, let me take another example so that you can really get the sense of what I am saying. Now, let's take nephros and renal. Both words refer to the same organ, but in the context it's being used, one refers to the disease condition, while one refers to the anatomical structure. Here we are talking about the kidney, but when they say something, if you say nephrosis, that is inflammation of the kidney, while renal talks about the anatomical structure of the kidney itself. I hope you understand. So these are the root words. We have derma, we have erythro, we have stoma. When you talk about stoma, you're talking about the mouth. When you talk about oris, you're also talking about the mouth. Oris or oral, you're talking about the mouth. While cortis, the skin, dermatos, the skin. We are still going to learn other parts of the body, but we are just using this as an example for you to know how the root words come about. Now we are going to move to the combining forms because I mentioned that some of these words might not really have meaning except we add certain alphabet letters to them to give it meaning. Now I'm going to write a word on the board now for you to see and see if you can pronounce it before we now add our vowel to it. When you see this word, Austin, does it mean anything to you? It doesn't, because Austin, what does Austin mean? But the moment we add a vowel O to it, it will give us osteo. And when you hear osteo, the thing that comes to your mind is they are talking about the bone. Now, let's take another example. Gastric. This does not have any meaning. But when we add the vowel O to it, it becomes gastro, and we know they are talking about the stomach. So that is how some combining words are formed in the medical words. We have nephro, we have hepato, we have erythro. When you hear the word erythro, you know they are talking about the blood, the red blood cell. When you hear the word hepato, you know they are talking about the liver. When you hear immuno, they are talking about the immune system. When you hear the word nephro, they are talking about the kidney. So some of these root words, if they are not combined with a certain vowel, most times the combining vowel is O. But we've seen situations whereby we use other alphabets such as IA or ITS, like let's take hepatitis. We have hepatitis. So the word that was added to it is ITIS, but in most cases, the combining word that is being added to the root word for it to have a meaning, for you to understand, is usually the vowel O. So that's about the combining forms. I hope that is very clear. If you have any question at this point, please ask before I proceed to the next stage. Does anyone have any question or clarification at this point? Questions, clarifications, anyone? Okay, in the absence of none, we'll proceed to the next part. And the next part is suffix and prefix. If we did our basic English in maybe our high school, I don't think suffixes and prefixes should be a strange thing to us. So now, who can explain what suffix means to me? Please, I said everybody should put on their video. Please, on your video, I need to see those that I'm talking to. Please, put on your video. Please put on your video. Emanuela, Jason, Cynthia, Elijah, Blessing, please put on your video. Emanuela. I hope
Yes,
Emmanuel
ma'am.
can hear me.
Yes, ma'am.
All right. So I need someone to explain the word suffix and prefix to me. When you hear the word suffix, what comes to your mind? When you hear the word prefix, what comes to your mind? Jason, can you please explain this to us?
Hello, good morning, ma'am.
Good morning.
Yes, suffix are a group of words or letters, a group of letters that when added to a word makes a new word.
Okay, suffix, prefix.
Yes, prefix are the one added to the back of a word to make a new one.
You are still saying the same thing now. The thing is, suffixes are words that you add at the start. You add prefix at the start of a word. Now, I'll give you an example of a prefix. A prefix, we have mastia. Sorry. We have mastia. This is a word. Mastia is a word. But in order for us for it to have a meaning, we can now add amastia. This A is a prefix. I hope you get that. So that's the word you add in front. While suffix is the one you add at the end. This IA is a suffix. This is a prefix. I hope you get that. So this is a full word, but we've been able to identify the prefix and we've been able to identify the suffix. So what does amastia mean? Amastia means without breasts. No breasts. That's what amastia means. So if you say mastitis, mastitis means inflammation of the mammary glands, the breast. So what is our suffix in this word? This ITIS is our suffix. So that is the word added to give a root word meaning. Because if we just say mast, what is the meaning of mast? We don't know. But adding this gives it meaning. Adding the prefix gives it meaning. Adding the suffix gives it meaning. Another example of a suffix is gastritis. Let's take gastritis also as an example. Gastritis. So this is our suffix. Gastritis means inflammation of the stomach. If we say gastromalagi, gastromalagi means enlargement of the stomach. So here, our suffix here is the omelagi. The O being the vowel that we learned earlier in the combining words, and the melagi being the suffix of this. So it gives the root word meaning. Another example of another suffix is gastroma. Gastroma. This means tumor of the stomach. Tumor of the stomach. So, as somebody in the medical field, you have to be able to understand all these words. They might look like jargons to you, but when you start your real medical practice, you see the importance of all these words and the reason why these words are actually important. We've talked about the suffix. Now let's treat some examples of prefixes that we have. Example of prefixes. I'll be giving several examples of a prefix. Now, this word, T-H-E-R-M, term, it doesn't have any meaning. Term, it doesn't have any meaning. But now, when I had iPad, when I add iPad and I add IA at the back, it gives it a meaning. This is my suffix. This iPad is my prefix. What does hyperthermia mean? Success. What's the meaning of hyperthermia? You are yet to mute your audio. I can't hear you. You are yet to mute. Unmute yourself. Please unmute yourself. Subtext, I can't hear you. Please unmute yourself.
Okay,
Okay.
no, I said, yes.
I'm listening. Can anybody hear what she's saying? Because I cannot.
Okay, I said that I've not seen the word. I don't know the meaning.
Hyperthermia. This is the word on the board. It's on the board. Can you see my board?
Yeah,
So this word, hyperthermia,
yes, I can see it.
what does it mean? Do you have an idea of what it means?
No,
Okay. Anybody? Chikenum, am I correct? What's the meaning of hyperthermia?
Good morning, ma.
Good morning.
Let's say it's a condition which your body temperature rises.
Exactly. It means when your body's temperature is excessive. Hyper, when you hear the word hyper, it means something is high. When you hear hypo, hypo means it is low. So hyper means high, and definitely the opposite hypo will mean low. So we have hypertension. That means your blood pressure is high. Hypotension, that means your blood pressure is low. So the hyper is the prefix in this word, while the IA here, hyperthermia, this IA is the suffix in the word. We also have myocardia, we have macrocardia, we have macrocardia, we have microcardia. These two words refers to the same organ. When you hear the word cardia, it means the heart. The word cardia means the heart. So macrocardia means when the heart is too big. While macrocardia means is a condition when the heart is small. We have intramuscular, that is within the muscles. Extramuscular, outside the muscles. So this, as somebody in the medical field, you have to be able to understand these terms. When you hear hypo, you should know that it means low. When you hear hyper, that means that thing is big, is much, is high. So these are the words that you need to know in the medical field. When you hear the word hepa means liver. When you hear derma means skin. When you hear cutaneous also means skin. When you hear the word nephro, then they are talking about liver. Osteo, we are referring to the bones. So you, as somebody, you have to be able to understand. Then when you hear words such as cardio refers to the heart. So we are still going to talk about all these organs later, we are still going to talk about each structure of these organs later as we go on. We are just starting with the root words so that you can understand, so that when I'm combining words for maybe when we are talking about the digestive system, and I am now mentioning gastro something, you will be wondering, okay, what does gastro mean? How did the word come to be? So that's what the introduction of this class is still all about. Later, we are still going to dive deep into each of these systems, into each of into different stages of the organs of our body. We are still going to talk about the renal system. We are going to talk about our circulatory system, the digestive system, our immune system. We are still going to talk about, because there are still other terms in each of all these stages that you need to know as a medical practitioner. So this is just like an introductory into medical terminologies. We are still going to learn some really, really hard terminologies that might be very difficult to pronounce, but as a medical practitioner, you need to know them. They are very, very important for you to know them. So I'm going to give you an assignment to go and do. It's just for your own knowledge, but the way I run my class is going to be very, very interactive. So I will advise that you prepare before you come to my class. I'll be giving you a list of things that we'll be doing in this class, that we'll be talking about, so that you can prepare. So if you have a note, please note down this, because these are the things during this semester that we are going to discuss. Next class, we are going to talk about the body structure. So you need to prepare, read for that, terminologies of the body structure. We are going to take that in the next class. Then we are going to talk about the digestive system, the respiratory system, digestive system, respiratory system. We are going to talk about the cardiovascular system, Then we are going to talk about the integumentary system. The integumentary system. Then we'll talk about the blood, lymph, and immune system. Blood, lymph, and immune system. Then we'll also talk about the musculoskeletal system. The musculoskeletal system. Then we'll talk about the genitourinary system. Then we'll talk about the female reproductive system. Then the last one is going to be the nervous system. The last one will be the nervous system. So, so that's what we'll be learning this semester. We're going to be learning the terms in each of these systems, terms that apply, diseases, the anatomical features of each of these systems, what they are called, how they are to be used, so that when you start practicing, they won't, because you are still going to, once you go into your deep core medical courses, we are not going to be using bone We are not going to be using kidney. No, we are going to be using all these medical terms. So in order for you to familiarize yourself with all these terms, that is why we are taking this course, which is very, very important, so that you won't look like a novice when they start saying, Dr. Jason, point to the renal system, and you start looking at the bone. Or they say, Dr. Success, look at the the patient has osteoarthritis, and you now start going to look at the skin, or you are looking at the kidney. Once they tell you, oh, a patient has osteoarthritis, that means the person has an inflammation of the joints. So you know that. So that's the reason why we are taking this class. So we'll be coming to the end of this class now. I would take questions if you have any. So please, if you have any questions, please let me know. Anybody, any question? Nobody has a question. Okay, if nobody has a question, I would explain again how this class is going to be run. So every week after the class, I will be giving you assignments which you are expected to submit. I'll be giving assignments which I hope you can hear me. Your assignment, you're expected to submit your assignment 48 hours. And the assignment is going to be part of your grade. So you have to submit the assignment 48 hours after you are given. Anybody that refuses to send the assignment by the deadline will not be graded, and they will lose that mark. So assignment is very important. It's going to be part of your grading for this course. Then attendance too is very important. As from next week, I'll be marking attendance for this class. So it is important that you attend this class. So that's my rule for the class. So in the absence of any question, we'll be coming to the end of the class today. So I'll be seeing you all next week. Thank you for your time.
Hello, ma.
Thank you.
Ma, please, is it possible to get your notes?
My notes.
Yes, ma'am.
Listed out the topics we'll be taking for this course. So what I'll be doing is you have to go and read out. Do I need to list out the topics to you? Because I want you to, I appreciate students that study on their own. It makes life easy for the two of us. So during my class, you have to be able to take down notes, though the recording for this class will be sent to you. The recording for each class will be sent to you to go through them at your leisure. So with that, you can use that to form your notes, but you have to learn to pay attention in my class. But I've given you the outline of what we are going to do. Should I state it again? Lesson.
Ma, I wanted to ask what the assignment was.
Sorry?
The assignment, you're saying about assignment, like you didn't tell us what the assignment was.
No, I'm not giving you assignment today. You'll be getting assignment from next week.
Okay, ma'am.
Yes, you'll be getting assignment from next week. And the assignment will be based on the topic that we take for that particular day. So any assignment I give you, you have to submit them to me in 48 hours. If you don't meet up with that deadline, you will not be graded.
Okay, ma'am.
Any other
Thanks.
question? Any other question? Okay, in the absence of any question, Have a great day and have a lovely weekend. We'll see you next week.
See you next week, ma'am.
Thank you, ma'am.
Yeah.